All right, we are here with Dr. Philip Chan from the Rhode Island Department of Health. Dr. Chan, we are talking about the hantavirus, and it was definitely news to me when I found out about this virus. I'd never really heard of it before, living in New England and around the area, but it has been in the news with the cruise ships and everything. So, first question is kind of a basic one. What exactly is hantavirus, and why should people be concerned of it if it does, expand in any sense?
So thank you for having me. So the hantavirus is a relatively uncommon RNA virus. It does exist throughout the world. Here in the United States, we generally see it in the southwestern United States, so not in New England, not in Rhode Island, and it can be a scary virus. There's over 40 types of hantaviruses. Only a few cause human disease, but the ones that do can be pretty severe.
Now, how exactly do people get exposed to this type of virus?
So hantaviruses live almost uniformly in rats, rodents. So the biggest exposure is coming in contact with rodents. If you have a rat infestation of your house or someplace where you live or work, that is the number one risk factor for hantavirus transmission infection. There is one hantavirus virus strain that can be transmitted person to person, and that's the Andes virus strain, and that's the one from Argentina and Chile. And that, unfortunately, is the one that we've been talking about lately, and is the one that's infecting people on this cruise ship.
And what kind of symptoms did the people on the cruise ship slash anyone be looking out for any sort of possible symptoms or exposure that somebody could come in contact with?
So again, in this situation, the risk to public health is incredibly low. The only people that should really be concerned are people that have been on that cruise ship in question or have known or been in contact with someone who was on that cruise ship. In general, we do know that rodents and rats carry a whole host of diseases, but the concern is low. When hantavirus does cause symptoms, it tends to cause fever and muscle aches and GI symptoms, etc. The concern about hantavirus is that in a number of people, significant number, it can progress to heart and lung collapse, respiratory failure, leading to death.
And you mentioned the mouse droppings people who have garages or sheds or anything or some sort of campsites. What should those people do? Looking to, and I've also heard something about sweeping or vacuuming. It's also considered dangerous. I don't know if you can elaborate on that at all.
Absolutely. So one of the biggest concerns is rat droppings, which can be aerosolized, right? When you're sweeping and you get all that dust particles up in the air. So the biggest things you can do, for example, are to work in a well-ventilated space. I would wear a mask and even eye protection if you're in an area that has a lot of significant mouse droppings, rat droppings, etc.
And are there certain times of the year where this exposure risk is high? I know you mentioned that it happens over south. I think it was southwest, I believe that you said before. Is there a specific time of year or other factors when it has to do with the climate or anything else that kind of heightens this type of virus?
Well, again, the biggest risk is really exposure to rats and rodents. Certainly during the summer months when there's more travel to the Southwest, there's been outbreaks, for example, at national parks and cabins and tents where there's been rat infestation. So people should just be aware of their surroundings, obviously, and just if you're in a place where there's possible rat exposures, you just want to take some precautions and make sure that you adhere to routine environmental cleanliness standards.
And here in Rhode Island, we have a lot of cruise ships that actually do come up into the port and everything. And I know a lot of people sometimes don't look into stories completely and they hear hantavirus and cruise ships and they make connection. They get a little worried. But, what is one of the biggest takeaways that you would want Rhode Islanders to remember when staying safe dealing with the hantavirus?
I think the biggest thing for Rhode Islanders to know is that the risk to Rhode Island is incredibly small. There's been no known contacts or exposures anywhere in New England, frankly. And the risk of cruise travelers, cruise people on cruise ships in general is low. We do know on cruise ships, given that that people can be packed in there in closed, tight spaces, that things like respiratory viruses and GI viruses like noroviruses can be more common. But the risk of hantavirus in general is really incredibly low. People should, again, just adhere to basic hygiene things like washing hands, etc.
And last question I have, I don't know if you can relate to this, but I know you are a doctor, but do you know the history behind hantavirus or, during your practices or studies, early on in your career, when you first learned of this disease, what were kind of some of the details that came around that?
Yes, we've known about hantavirus for decades and decades now. The CDC and other public health entities have been watching for this, conducting surveillance. So we've known about it for decades. And I think that's one of the strengths of what's happened. One of the advantages of public health in general. We've seen how public health was able to identify hantavirus on a cruise ship. They're able to isolate passengers. They're able to get people who are sick into treatment. This is what public health does. And this is really an example, despite the severe, significant situation, that public health works in general.
And we're coming off. I mean, it's been 6 years since the beginning of COVID, but we've heard a lot of doctors come out and say that this, not a COVID pandemic. Why do you think that that is important to note, especially only a few years removed from the first pandemic that many of us have gone through before?
Well, I think we're all, have some trauma from the COVID pandemic. And I think there's a tendency to compare everything now to COVID. And I think the issue with COVID is that it was really infectious. Things like hantavirus, very severe, very significant. Other things that you may hear about in the world, things like Ebola, et cetera, very significant infections, but they're not transmitted anywhere near as easily as COVID. And so I think there's a tendency again to overthink it, be worried. And certainly we in public health are watching this situation carefully. We're watching for Rhode Islanders who may have been exposed or come in state, of which there are none. But in general, I think people should just realize that there are many of these different infectious diseases out there around the world, of which hantavirus is one of them. But really, the risk to the public is really incredibly low.
And in your expertise, has Rhode Island ever had a case of hantavirus in the past?
Not to my knowledge.
All right. And
Yep,
is
no
there
known cases here in Rhode Island.
Okay, and is there any other information that you think that we would be good for viewers to understand about this virus that not many people have really heard of up until the last week or so?
Again, it's a very severe virus. It does have a high mortality rate, meaning if you look at the studies and outbreaks in the past from across the world, up to 30 to 50% of people can die from this virus. But again, it's very difficult to get. And certainly, if people have concerns, they should talk to their physician. If people believe that they've been exposed or have any significant questions about what's going on, please do contact us at the health department. That's what we're here for.
All right, and that is Dr. Philip Chan with the Rhode Island Department of Health. Thanks for joining us.
Thanks for having me.